All right, let's jump right in. Today we're tackling a really big topic, the role artificial intelligence is playing in the fight against global pandemics. And what you'll see is that this is a story of incredible, almost sci-fi level promise, but it's also a story filled with some profound ethical questions we have to answer.
So before we can even talk about AI, we first have to understand the problem it's trying to solve. Why is the need for these new tools so incredibly urgent right now?
Well, just take a look at this timeline. It really says it all, doesn't it? In just the last 20 years or so, our world has been hit by a relentless, accelerating series of major disease threats. We're talking SARS, H1N1, MERS, Ebola, Zika, and of course, COVID-19. It feels like these outbreaks have become a constant feature of our lives, testing our global health defenses over and over again.
So what's going on here? Why is this happening? Well, research points to what's really a perfect storm of factors. We have more global travel than ever before, more people living in crowded cities, and huge ecological shifts happening because of climate change. You put all that together, and you've created the perfect breeding ground for new diseases to pop up and spread faster than we've ever seen.
It's in this really challenging new world that artificial intelligence has stepped onto the scene as a seriously powerful new tool. So let's break down exactly how it works. To really get what AI is doing, you need to know about the two main ways we track diseases. First, you've got the traditional method, called indicator-based surveillance. This is all the official stuff. Lab reports, data from hospitals. It's super reliable, but it's slow. On the flip side, you have event-based surveillance. And this is where AI is a total game changer. It sifts through the messy, chaotic, real-time flood of information on the internet, news articles, social media, blogs, looking for those first faint whispers of an outbreak.
And get this, the importance of all that messy, unofficial data is just staggering. The World Health Organization says that today, more than 60% of the initial reports of an outbreak come from these informal internet sources. AI is really the only tool we have that can make sense of all that noise.
And there are already some major systems out there doing this work. You've got Canada's GPHIN, which is constantly scanning news feeds. There's HealthMap, which comes out of Boston Children's Hospital, and it pulls from news, official reports, even eyewitness accounts. And then there's ProMed, which uses a global network of experts on the ground. They're all using technology to piece together this giant global health puzzle in real time.
This right here is the perfect example of that power in action. Think back to the very early days of COVID-19. An AI system from a company called Blue Dot was the first to flag that weird cluster of pneumonia cases in Wuhan. It actually sent an alert to its clients days before the World Health Organization could put out its official warning. And in a pandemic, a few days can save countless lives.
So that's the incredible promise, right? But with that power comes some huge ethical challenges. And that's really the core tension of this whole story. It's a double-edged sword.
We've just seen what AI can do, which is amazing. But it forces us to ask a really tough question. What is the cost of this power? What are the trade-offs we're making when we unleash these kinds of systems on the world?
To dig into that, we're going to use a framework from our source material called AI for People. It's great because it gives us 5 key ethical principles to think about whenever we build and use these technologies for global health.
These 5 principles, justice, non-maleficence, autonomy, explicability, and beneficence, they're basically a roadmap. They help us ask the hard questions about the tools we're building. So let's break them down, one by one.
First up is justice, and this one is all about fairness. It makes us ask, are these powerful AI systems helping everyone equally, or do they risk just making the gap between the rich and the poor even wider?
In this chart, well, it shows a pretty stark reality. The huge majority of these advanced AI systems are built and run in high-income countries. What that means is we have massive data gaps and potential blind spots in low- and middle-income nations. You know, the very places that could be most vulnerable to an outbreak. That's a fundamental problem of justice.
Okay, so from fairness, we move to our second principle, non-maleficence. It sounds complicated, but it's based on a simple idea from medicine. First, do no harm. This is where we have to face the direct risks these systems can pose, especially when it comes to our personal privacy. And this creates a major conflict. On one side, you have the public health goal of stopping a deadly virus, which might mean tracking people's contacts. But on the other side, you have our fundamental right to privacy. We saw this exact debate play out all over the world with contact tracing apps. Finding that right balance is an enormous challenge.
And you know, harm isn't just about privacy.
What happens if an AI makes a critical call based on bad or biased data? Or what if an algorithm that worked perfectly in a lab setting just falls apart in the chaos of a real crisis? These are all very real ways harm can occur, and we have to guard against them.
This leads us right into our third principle, autonomy. And this one is all about power and control. At the end of the day, who's in charge? Who gets to make the final decision? A human expert or the machine?
A huge risk here is misinformation. Think about it. The same AI that's so good at finding disease signals in social media, well, it can't always tell the difference between a real event and a viral rumor or fake news. If these systems start amplifying false information, they can destroy public trust and actually undermine the very health agencies they're supposed to be helping. It's a perfect example of that double-edged sword.
Okay, our fourth principle, explicability, really gets to the core of the trust issue. It asks a simple but really profound question. If we can't explain how an AI came up with its answer, can we really truly trust it?
This is what everybody calls the black box problem. With a lot of these complex AI models, we can see the data we feed them, and we can see the answer they spit out, but the logic inside, it's so complicated that sometimes even the people who designed it can't fully explain it. Now, if you're a public health official making life-or-death decisions based on that AI's advice, you have to know why. Without that why, accountability becomes pretty much impossible.
So, we've worked through the big ethical minefields: justice, doing no harm, human control, and the need for explanation. That brings us to the path forward. And that path is guided by our fifth and final principle, beneficence, which is just a fancy way of saying we have a proactive duty to do good.
And this, right here, is the key takeaway. Fulfilling that duty to do good isn't about writing better code. AI is not just a technical problem, it is a profoundly human problem. The only way forward is to build our shared values, things like fairness, accountability, and human dignity, directly into the design of these systems right from the very start.
Which leaves us with one last, massive question. As we build this future, who gets to be in the room? Who gets to decide which values matter most, and what an ethical AI even looks like? This isn't just a question for software engineers and data scientists, it's a question for all of us.